just so that for transparency, the mom knows that I'm presenting this and she has given me full permission. She gave me pictures for it. So, and she gave me updates today. So we have current information and current pictures of the baby. All right. So let's see. This is a 35-year-old G6P5. She breastfed her first four babies for 12 months with no problems. Before this pregnancy, between number four and number five, she had one pregnancy loss, which led her to go find out what's happening. She was diagnosed with some thyroid issues and she was put on thyroid medication up until 6 weeks ago, or 6 weeks before the first visit. And she was also diagnosed with a pituitary adenoma 4 years prior, and she was put on bromocriptine until pregnancy. So, all of you soon-to-be test takers, bromocriptine is a drug you need to know. It will be on the exam. It's one of the few drugs that'll actually be on the exam. And bromocriptine is used to inhibit prolactin secretion so that a person doesn't lactate when they're not supposed to. So this baby was a normal spontaneous vaginal delivery at 40 weeks. The kid was 6 pounds, 13 ounces at birth. On day 4, the baby was down 8%. At 1 month, the baby was up to 7.2, which was a 5-ounce gain. The baby was at the first percentile, and that was a 1.2-ounce average per week gain at 1 month. Anybody freaking out a little bit? It's not great, right? At 2 months, the baby was up to 8.7, which was a 1 pound, 10-ounce gain down to the 0 percentile. And that's a 3-ounce average gain per week. All right. Now, what questions do you have about this case so far, just based on what you've seen here?
Why isn't the pediatrician freaking out?
The pediatrician was this really old school guy, and I think from what I get from the mom that maybe the pediatrician was freaking out, but because this is baby number 5, she was a bit of a like, I know what I'm doing. I'm just going to breastfeed my baby and I'm not willing to supplement. Yeah. Yeah.
So did the other babies not go have a pattern like this? Is this really different from her other
He
babies?
said slow gain, but it was not a red flag in any way. Yeah. So this is all the red flags, right? So if you were looking at if you heard this history and you go there and you see this, what do you expect to happen at the visit? I mean, I would expect just off the bat, based on this, there's probably not enough breastfeeding or there's a really low milk supply. And based on the thyroid and the pituitary, I'm thinking there's no milk available to this kid, right? All right, so let's talk about the visit. So when I saw her, the baby was 4 months old, 9 pounds, 9 ounces, 4 months old, 4 months and 9 pounds. Crazy, crazy. 2.5 ounces average gain per week. We expect babies to gain a lot more than that. So these are crazy, crazy. Exclusive breastfeeding. She had only been putting them on one side because she believed, based on what she read on the internet, that baby would get more fat if she kept him on one breast. So he fed every 1 to 2 hours, she said. She said he was very happy, pleasant baby, wasn't crying all the time. He's just skinny. That's what she said. She refused to supplement him with formula. She did not want to do that. He had good voids, 1 to 2 stools per day for a 4-month-old. I'm not super concerned about that. But I'm concerned about his weight, and I'm concerned that he only transferred 30 mLs. Right? So what would you expect the plan of care to be? Anybody? I mean, we need to get milk in the baby. Remember, feed the baby, protect the milk supply. So I need her to triple feed. Um, so I want her to offer both breast. I want her to do breast compression. I want her to add pumping. So the four kids are at school. When I saw her, I think I saw her in April was the first time. So her kids were still in school. So she's home with the baby all day. She said she could manage pumping after breastfeeding during the day only. So I wanted her to add pumping. I wanted her to do both breasts, and I wanted her to supplement with breast milk. If
Was
she
she pumping at all? She was only just direct feeding one side. That's it.
Yes, 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 one side. She was kind of like she probably weighed 200 pounds. So she wasn't like undernourished or skinny or anything like that. Like I wasn't worried about the her nutrition or anything. There's really something hormonal going on here. So I'm going through all this with her, and I said, you know, your history of breastfeeding four babies successfully without having to supplement, and then suddenly having this kid, there's something not that doesn't add up. I said, with your fifth kid, I would expect you to have so much milk, it's like coming out of your eyeballs. And so we talked all about the birth. Was there any kind of major blood loss? Was there any change in your, your thyroid or your hormones or anything like that? I mean, it took a lot to learn about the pituitary adenoma. She did not even think to connect the dots that that was important in the beginning. So we talked about her thyroid some. So she was on levothyroxine from her primary care, but she was having like joint pain. So the provider, the primary care told her to stop it. So she hadn't taken it in 6 weeks. The kid is 4 months old. She hasn't taken it in 6 weeks, but she's also taking a joint supplement called Osteobioflex because she's having arthritis-like symptoms. Her provider said it's probably related to the thyroid medication, so let's stop it. Well, there's something, so remember that because that's going to come back. So of course, I want her to triple feed. She's willing to do sort of a triple feeding plan. She's only willing to supplement whatever she collects. She's not willing to give formula. We talked about donor milk. She was not really on board with that. She doesn't want to give solids yet. She so I referred her to a breastfeeding medicine physician. And I said, you can go see your primary care again, but I feel like we need somebody else to look at this that understands the nuances of how thyroid affects lactation, because I feel like maybe your provider is missing that if they're just a general practice person. So I referred her to Dr. Federici. I've interviewed her on my podcast, so you can listen to her if you want. So this is the 4 month old that I saw. Yeah. He is all head. He's all head, skin and bones, skinny little, terrifying. He was tiny. He was tiny, tiny. Look at that. His legs look like newborn legs. Mm-hmm.
I mean, there's a point at which a pediatrician could diagnose failure to thrive here.
Apparently, we don't use that term anymore.
Mm.
Mm-hmm. Yeah, I think I mean, she was going to the pediatrician, but she didn't like him. Did not trust him. She did not like him. She did not like that he kept telling her to give formula. So I think that's what pushed her to call me because she's like, I need to fix this so the pediatrician will leave me alone. Yeah, this is terrifying, right? Yeah. All right. So she goes to see or has an appointment with Dr. Federici. Dr. Federici orders labs, and also her labs are for thyroid and to check her prolactin because she had to bring the baby with her, breastfeed the baby, and then do the blood draw like immediately after the baby was breastfed so that the prolactin would be spiked. So apparently the prolactin was okay, but the thyroid was really low. Well, here's the interesting thing. Dr. Federici told her that joint pain that you were experiencing is more related to the fact that you need thyroid medication, not that your thyroid is too much. So they put her on 25 micrograms to try that. And when I saw the kid today, he was up to 10 pounds, 3 ounces. So it was about 18 days, 2 weeks later when I saw him the second time. So remember last time it was 3 ounce average gain per week. This time it was 3.1. So it's just a tiny bit up, but there's some progress, right? Um, and the kid took 40 this time instead of 30. So there's incremental progress, incremental. She
40 both breasts or just with one?
using both breasts. She really didn't see any change with the pump. So it's not really a stimulation issue. I mean, he's already nursing 10 or 12 times a day. Even at night, he co-sleeps. So he's on the boob right there constantly. So I told her to keep doing all the things, but I wanted her to follow up with Dr. Federici again because it really wasn't enough progress. So she ended up, the levothyroxine got increased to 50 micrograms. I wish I could tell you that this fixed everything, but it increased it some, but this kid has, I don't know if he'll ever catch up. That's what I want to say. So today she told me she changed pediatrician. She found somebody that she liked and trusted. This is her text from today. He's doing great. The pediatrician thinks his chart looks better now than he did at 4 months. So that's great. And he's getting solids and nursing on demand. So she said that things are going better. This is him today. So this is a 9-month-old. Yeah. I mean, he definitely has a little more chub on him. His legs aren't quite as skinny as a newborn, but holy moly. I'm hoping the solids will put some fat on him. And, all of his growth has gone into his brain. That's it. I mean, his brain was protecting. Hopefully he will. This says 7 months, but he's now currently today, he's 9 months. Crazy, right? Crazy. So
Milestones and everything? Was she like worried about milestones or was he doing fine in that aspect?
she said he met all of his milestones. That's what she told me. Now, obviously, I've never communicated with the pediatricians, or they've never told me anything. She claims he meets his milestones.
So like happy and okay.
He seemed happy. When I saw him, he smiled at me. He's just scary, thin, tiny,
Yeah.
scary,
Like,
tiny.
like he's suffering.
I know, but he was so happy. He smiled. He wasn't crying. I mean, there's a look about babies that aren't getting fed enough. They have a furrowed brow and they look really serious. He had never looked like that to me. But yeah, all right. So this is the sort of the information we need to understand here. So I asked her if she knew what kind of pituitary adenoma she had or the size of it, and she didn't know. She said she thought it was on the bigger side. So pituitary adenoma is a benign tumor of the pituitary gland, and it can affect lactation in several ways depending on the type and the size. So there's one that secretes prolactin, which is probably what she has because they gave her the bromocriptine to suppress the prolactin. And then there's non-functioning, which may not have an impact on supply, but it also may blunt milk production going the other way. So this is problematic. Then we look at the hypothyroidism. So hypothyroid reduces prolactin receptor sensitivity. So the body is less sensitive. So even if her prolactin was okay, if her thyroid's not right, it's not going to work. Her receptors aren't working right. Now, here's the combined effect. So if a mother has both, the risk of insufficient milk production increases significantly due to compounded hormonal disruption. So the adenoma may reduce prolactin or oxytocin output if it impairs overall pituitary function. And then hypothyroidism further reduces the efficacy or the efficacy of prolactin through receptor downregulation. So according to her, when I texted her today, Dr. Federici, the breastfeeding medicine physician, wasn't worried about the pituitary adenoma, but I am. But yeah, so let's just go back and look at his pictures one more time. There he is at 4 months. So you can see he's definitely grown a little bit. He looks a little bit thicker. His face looks healthy, but his body is Scrawny. Scrawny. So this is why, it's really important for us to keep digging and remember what is normal. What would we expect? We would expect with a mother that's nursed 4 kids successfully, number 5 is going to be okay unless something happened. And that's where all my red flags were going off. Like there's something we're missing here. What is it that's causing this? You didn't have breast surgery. You didn't have a major hemorrhage, what's happening here? So, all right. Any other thoughts or questions on this one?
I just seen something about this in a group that I'm in, as far as like there was a girl that was on there. She had taken bromocriptine like as a teenager,
Mhm.
um, because she had had a pituitary adenoma, and so she just assumed like I took something as a teenager because I was lactating then. Like when when she had the baby, she thought it would be no problems.
Mhm.
So there's a multiple people in there saying that they've taken it before, and because of that, they don't know if it's like the medication or just that they had the adenoma, that they were never able to get a full milk supply.
Yeah, that's interesting. I did have a mom once that had a pituitary adenoma and used bromocriptine as a teenager, and she was okay. But yeah, I mean, we really don't know. And maybe there were other medications that interfered. There's just so many things that we have to consider. Yeah. Any other thoughts or questions on this one?
I don't even know if this is a question, but like, if you know there is something going on physically that you can't necessarily fix, like, why wouldn't she want to supplement? Like, I don't understand the hesitation there. And I know you always say, like, you can't want it more than them, but I also just feel like if your baby's in danger and there's a physical obstacle, like, I guess I don't understand how to like be normal about that.
She didn't believe her baby was in danger. I think she called me to confirm to her that the kid is fine because her pediatrician's the one that kept telling her, we need to do something different. You need to supplement this baby. He's falling off the chart. He literally fell off the chart. And I think she was calling me to back her up when that's not what needed to happen. I showed her, based on your baby's weight, this is how much he should be taking at his age. Based on his age, this is how much he should be taking. So he's this far off from where he actually should be. And I think that was kind of like, oh, okay. But it wasn't enough to make her do anything. I think the reason that she went to or did breastfeeding medicine is because it was easy and she didn't really have to do that much. She did it from her phone, telehealth. I don't know, but I don't think she really believed there was anything wrong with the baby. If he was really fussy and crying all the time, it might have been a different story. But this was a happy baby. He was happy. So she didn't really believe anything was wrong with him. She just thought he was little.
With that like slight increase when she increased the medication or put her back on the medication.
Yeah.
Is that Do you think how much of that do you think was affected? I mean, I know we can't know by the fact that it happened at 4 months. And if we'd sort of done it earlier,
You know,
milk supply wasn't as set. Do you think you would have seen a bigger increase?
I don't think that the timing is really that significant because the stimulation was really consistent throughout. I mean, she started off nursing that kid around the clock and she never really stopped. I think that we probably should have seen a bigger increase in because of the change with the thyroid if the pituitary adenoma wasn't also causing something. Maybe, I don't know. Maybe Dr. Federici wanted to follow up with her more and she wasn't willing to. I really don't know because I can only go on what she tells me, right? And I only saw her twice. She didn't have insurance that would pay for her to see me. So it was cash. So she really wanted to limit it. And she texted me primarily when I didn't see her those 2 times. So I don't know. Maybe there was a follow-up plan that wasn't followed that I'm not aware of. Yeah. Pretty interesting though, right? This is one of those like once in a lifetime things. You're probably never going to see it yourself, or maybe you'll see it one time. But the key takeaway here is you know what normal is, and if this is outside of normal, you need to start digging to figure out why. All right, I'm going to stop the recording so we can talk about whatever you want.